lot of menopause symptoms. And unfortunately, when you look at the numbers, you see younger women looking terrified, thinking that this is what it's going to be like. But the fact is that estrogen affects every part of our body, or hormones do, so that then when you don't have them, any part of your body can be affected. So there are at least 40 different symptoms. So the most common symptoms will be hot flushes and hot sweats. The sweats are usually at night. Psychological symptoms, so brain fog, anxiety, mood changes, poor sleep. Musculoskeletal symptoms, so aches and pains in places that you never had them before, recurrent inflammatory problems, frozen shoulders and so on. Urinary symptoms, so women might be going back to their GP with recurrent urinary tract infections. That can be a symptom of the menopause, or getting up in the night to pass urine, or some urinary incontinence, stress incontinence when you cough or sneeze. And then sexual changes, so vaginal dryness and soreness, which can make intercourse sometimes impossible. And lack of libido is another common symptom. Thankfully, we won't experience all of them. That's highly unlikely. But 80% of women will experience something. And it may be that you're experiencing slightly unusual symptoms like gastric symptoms or problems with your mouth. So that's why it can be a little bit difficult sometimes to join the dots together to work out whether or not this is the menopause. So hot flushes are a very common symptom of the menopause, and they're very variable. So some women might describe a slight palpitation at the beginning, then a feeling of heat in the chest. Your face can go bright red. You can start dripping with sweat in the back of your neck. It's thought to be because the thermoregulator, so the bit of our brain that regulates our temperature, doesn't work properly. But again, it can be very variable. Sometimes you might just have hot feet. I had hot legs when I had hot flushes. So it's very, very variable. So anxiety is a common symptom of the menopause. And unfortunately, many women, when they go to seek advice, end up on treatment, antidepressants. And of course, at this time of life, there are lots of other things going on. So you might have kids that are not well, parents that are not well, work problems. So it's easy to see how this can get labelled as depression and treated inappropriately. But actually, our mood is very much influenced by hormonal levels. So if your estrogen levels are very low, then that can really affect your mood. Progesterone helps you sleep and is good for anxiety. So deficiencies in these hormones can have a real impact on our mood. The sleep pattern is affected by menopause for different reasons. Firstly is hot flushes and night sweats in particular. So some people I talk to are getting 5 or 6 sweats every night. So that means you're waking up, you're dripping wet, you have to change the bed. Or it may just be that you wake up. So insomnia without the night sweats can be a symptom of the menopause. Sometimes it's because you're in pain, because you're getting these inflammatory joint problems. It might be because you're having to go to the loo all the time. But estrogen and progesterone are also involved in the production of melatonin, which helps us sleep. So sleep problems are very, very common in the menopause, about 60% of people.